Good morning, Hawford Health Centre. How can I help?
You haven't told me how much you were drinking. I don't know if you want to.
No, because I'm always embarrassed when you ask me.
OK, well, I won't ask you again.
I was scared. I was scared of going to the gym. Don't know why.
What are you scared about?
Because I'm fat.
What about smoking?
Yes, I do smoke.
I mean, smoking does make you much, much more likely to get this kind of thing, yeah, unfortunately.
I cannot shift this weight. It's like just eat everything in the fridge. I don't even open the fridge. It's like I shoved the whole fridge in my mouth.
Resolutions can kickstart people in wanting to make some changes with regards to their health.
Perhaps stop smoking, take more exercise, spend more time with their family, do healthy, positive things.
Davis, please. Hi there, thanks for waiting. Have a seat.
Thank you.
Right, what can I do for you?
I've been swimming a lot. I started swimming three times a week because I want to try and shift this weight. I am really trying hard now. I sort of swim a good mile at least 3 times a week, aqua aerobics. I've got exercises from the physio for walking and that, but I cannot shift this weight. I joined Slimming World and I can stick it for a couple of weeks and then it's like just eat everything in the fridge.
What's your real downside, do you think?
Anything sweet, I will just... Oh, yeah. And it's not... I wouldn't think, oh, yeah, I'll have one of those chocolate bars. I'll have the whole packet and not feel bad about it. I actually feel good when I'm eating it, so this is the problem.
What we should all learn when we've got weight issues is about what we're putting in here, really. And
I know what I'm putting in is wrong.
Yeah, it's about a healthy eating plan. It's not about, oh, you can't have that. It's about, right, let's pick things that you really like and eat them well, and then things that
It is good. I mean, I've done it before and it's really worked for me, but just this time it's like...
It can work again.
Yeah, OK.
Is there any way the Slimming World people can help you when those attacking the fridge moments come?
I don't even open the fridge. It's like I shoved the whole fridge in my mouth.
Yeah.
And it's almost like I need it. It's not, oh, I really fancy that. I need to eat it.
Right.
And I'm really, really struggling.
I think you're doing everything you can.
I'm trying everything and I'm really exercising, but it's just going on.
So exercise by itself won't do it. That's what they've guidance has said lately.
Yeah. I'm going back again tonight with my daughter because I was going and then I stopped. I thought I'm just wasting my time.
But it is good going and staying. Do you stay at the group?
Well, my daughter wants to tonight. She's put on a few pounds, so she wants to go and she'll be, I'll stay with you.
Everybody in these groups are in the same boat, aren't they? And if they're still losing weight, they might have ideas and techniques of what they've done to overcome it.
Yeah, OK.
Yeah?
All right. OK, then. All right,
no
lovely.
Bye-bye.
Thank you.
Hi there, come and have a seat. Hello, hello, hello.
Hi.
So, Jessica, I'm Dr. Lee. Now, what's the problem?
Hi, Dr. Lee.
Hello.
In school, I could feel this part of my nose really hurting when I touched it. So when I went home, I put something cold on it. And then today, after school, I told my dad to look at it because it hadn't stopped, and he said it was
swollen inside.
Swollen inside. OK. Listen, I'm going to look up your nose. How about that? Now, is it going to hurt if I put this in here, do you think?
If you press it, that's when it hurts.
OK, so I'll go very gently. Is that all right?
What do you see?
Nothing yet. Is that the bit that hurts?
Yeah.
Yeah.
Ow.
Oh. Just round leg.
OK. Well, that was a bit painful, huh? Have you or anyone in your family got sores on your mouth called cold sores? Do you have cold sores in the family? Yeah. So occasionally you can get a cold sore up the nose, and it is really painful. Now, that's not a dangerous thing, but what usually happens is it's sore for quite a few days, maybe a week. And then after that, you can get crusting in there that lasts for another 2 weeks, so maybe 3 weeks altogether. I can give you some cream to put in there. Now, listen, put a little bit on the end of your finger and just put it up your nose and rub it round that sore area 5 times a day. And you can do it maybe for 5 days. If it's this, I'm afraid it's still going to be crusty and sore for 3 weeks. We'll see you later in the week. It's a pleasure. Thank you. I'm sorry your dad did that to your nose. I look very sore.
Thank you.
Bye.
OK, OK, bye-bye.
What do we need to discuss?
I think my ulcer's playing up again.
Just point to where the discomfort is.
It is, like, on my right-hand side, and every time I move, it just feels as if someone's giving me a right wallop in my right-hand side, right on me, like, my kidney side. But I have been under a lot of stress lately.
Was there anything obvious that caused it to come on, other than perhaps the stress?
My partner probably said I was drinking too much.
So, to be clear, was it after you started drinking that this discomfort came on?
Yeah, it came on, like, Sunday. Then Monday I was in discomfort, and then I made a decision not to go work on the Tuesday, and I haven't been in since.
OK. And what have your bowels been like?
Probably gone more than what I usually have gone.
Okay. Loose stools?
Yes.
Stools? Loose stools?
Yeah.
Okay. Any blood in the motions or anything like tar in the motions?
No.
And any urinary symptoms at all? Because, as you say, this is a little bit in the kidney area. Have you noticed anything with your urine?
Just going rather a lot.
All right. Should we have a feel of the tongue first?
Yeah.
Yeah, OK. Hop up on the couch.
Yeah.
If you can lie up here. OK, nice head down flat.
See, that hurts doing that, look.
Does it really? Yeah.
Yeah.
So this is where you said you were feeling the pain?
Yeah.
That's sore. We come down here. You're gripping your teeth there, aren't you?
That was hurting there.
Yeah.
Yeah.
What about if I press in here?
That's it.
Interesting.
I'm not eating, but then I'm putting on weight.
With all due respect, if you're really not eating, you're not very likely to be putting on weight.
I bet my BMI is 26.
27.
Oh, no!
You're coming out at a high body mass index, which would indicate that you're overweight, potentially obese.
I was eating everything that I could see.
Yeah.
I'm 64 years old and I look like Mr. Blobby.
Have you joined Slimming World?
I put weight on.
Did you?
So I stopped going.
How long did you try it for?
3 weeks.
My wife's trying to lose weight.
Right.
And she's always going to give you these fancy foods like couscous and all that.
80% of weight loss is eating less.
It's like, can't I just take a pill? That'd be so much easier.
Come on in, come and take a seat. Yeah, it's not too bad, thanks. How are you? How can I help?
What it is, the bottom of my foot, the heel bit there, is swollen really bad, and I can't walk properly on it.
OK. And whereabouts does it hurt? In the heel?
Like, all in there, up there.
OK. When you wake up in the morning, is the pain OK? No.
It's the time it hurts is when I go to sleep, because you're asleep, you don't feel it. And when you wake up, sometimes I'm thinking, cool.
OK, so let's have a look. What might be easier is if you come and have a lie down up here, pop socks and shoes off and just come and have a lie down there.
Softy smell, cool. Some part reason why...
Don't worry about that.
I did have a wash, but some part reason my feet keeps on smelling all the time.
That's all right, don't you worry. Got interesting legs, anyway.
Hey?
Interesting legs.
Oh.
So it's the right foot.
Yep.
Do you get pain in here?
Yeah.
It's just in there. So in that point there, when you put pressure on that area, does it hurt when you walk around?
Yeah.
OK. And if I press there, you've got the pain. Sorry. But in the back here...
sometimes the pain does come up and
it comes up there,
as well.
Yeah. Come and take a seat. So 2 things. One is, it sounds a bit like what we call plantar fasciitis.
OK.
OK? Underneath the skin, you've got a kind of fascia, or this kind of membrane type thing, and it can get inflamed. And it feels like someone stuck a pin in your heel. There's certain ways to just help it along. And actually, your feet could do with a little bit of support in the arches, because they're slightly flat. Swimming might help. Losing a bit of weight might help.
I was just about to say that.
Yeah. We are doing, in the treatment room...
I was scared. I was scared of going to the gym. Don't know why.
What are you scared about?
So fat.
But if you went along to the gym, they can show you exercises that suit you. Because there's people of all shapes and sizes going.
I can't put... Oh, yeah.
Not be worried, because you're only 29, aren't you? So
I don't know why. I should not be scared, really, but I am.
Yeah, no.
So my friend goes, he said, mate, there's a bloke that's like 34 stone.
It's quite good to go with a buddy if you've got a friend that wants to do it with you. So go along, give it a go.
OK.
All right.
Brilliant, thank you.
You're welcome. Take care. Bye.
Bye.
I mean, I think there are several possibilities here, actually. Could this be to do with duodenal ulcer? Yes, it could. But the duodenal ulcer doesn't really explain the flank pain particularly.
Right.
We also worry about inflammation of the pancreas, which is, can certainly happen after heavy drinking.
OK.
OK. You haven't told me how much you're drinking. I don't know if you want to.
No, because I'm always embarrassed when you ask me.
OK, well, I won't ask you again. It's important to be honest with your doctor about how much you're drinking. After all, we are here to help you, but we can only do that if we know what the main issues are. Many people do drink more than is medically sensible, particularly over the festive period. So the new year provides a good opportunity for making changes for the better. So that could be a factor. OK, so pancreas could be a factor.
OK.
So we look for that with a blood test. I'd like to get a urine sample done off you now, I think.
OK.
And then we'll have another chat on the phone this afternoon once we've got results back.
That sounds fine.
Do you think you can go do the pee sample for me now?
I could try.
Go and have a try. OK, there we go. You know there's a loo at the end of the corridor?
I do.
OK. So if you just go up to the end there and then back to room 2.
OK. OK.
Mary Penny. Hello, come on through.
Hiya. Hiya. Thanks for seeing me.
That's quite all right. How can I help today?
This has been on my ear since February, and now it's started to erupt. It's opened. And I'm not sure what it is. And it's not going away.
How does it feel?
It's quite sore when I lie on it at night, so I don't. It has a sort of burning feel to it, but then that could be because I've now just been touching it.
Any history of skin problems at all?
No, not really. I mean, you know, obviously at my age, all sorts of weird lumps and bumps form, and then they go.
Yeah.
But it's because this is persistent and it's in a sun-exposed area. I just sort of might just let someone look at it.
Yeah, no, absolutely.
It sometimes sort of prickles a bit, almost as though there's a sort of cactus spine in it. It's just a prickle.
It almost has a shiny quality to it, doesn't it?
I don't know, it's quite hard to see.
Yeah, I suppose it's a difficult area for you to see.
Yeah.
OK. Well, it certainly is a sun-exposed area, and I think we take persistent growth like this quite seriously.
OK.
What it looks most like to me is something called a BCC, which is it is a type of skin cancer, but actually, if you're going to get something cancerous, it's probably
on the good list.
On the good side, in that it's slow-growing, never invades other areas, so doesn't spread anywhere.
Yeah.
And so it's something we deal with kind of on a much more routine basis.
Is it treatable?
It's something we would remove.
OK.
If it continues to grow, it can disrupt local structures like the cartilage, etc., in your ears, and become increasingly difficult to cut out. Is there any questions that come from that, or any worries?
No. I mean, it was just a case of I wanted to come in and find out what it was, because better the devil you know, really.
Yeah. People can sometimes put off coming to see their doctor about lumps or bumps. If you're worried about a lump, particularly if it's growing or changing, I would encourage you to come and see your GP about it. So, what happens next? It is important that you see a specialist. I think that's the first thing to say about definitive treatment, and I suspect that will be cut it out.
OK.
So I'll send a referral letter off.
No, that's great. I'll let you get on with this. Thanks very much for seeing me as well.
No problem.
So was it painful when you peed then?
No, it's not painful.
I think it's going to be normal. I'll just let that cook for a minute. I'd like to take a blood sample. Can you do that now? Yeah. Well, actually, this is interesting. There is just a tiny trace of blood in the urine. Now, some people do get that for no bad reason.
OK.
But if we don't find anything on the blood tests, maybe we should think about investigating a kidney, which... OK. Most important thing is to check for the pancreas problem we talked about.
OK.
Also check your kidney and liver tests, and I'm checking your blood count as well in case there's any clues on all of that. All right. Great. OK, so that will be back by mid-afternoon. OK? All right, we'll speak later.
OK, thank you,
all right,
Dr. Hill. See you again.
Bye.
All right, cheers.
I've got an appointment at 9:40 today with Dr. Pele.
It's 10:40.
Can I rebook that appointment with him?
Can't wait for it, no.
Well, not an hour.
What are you looking for?
It's all right, there's a little problem. I've got it wrong again. It's 10:40. I mean, I'm happy to do 10:40. It just means I've wasted my wife's trip down here and I can come back.
Look, I'm getting rid of him for a day soon.
Yeah.
He's going to his sister.
If he would like to see me at 10:40, I don't believe...
That'll be fine.
All right. OK, thank you.
So I noticed that last time you came in, you saw Dr. McLaren, and he said he wanted you to have a chest X-ray. Did you ever go for the chest X-ray?
No, I didn't. I was so busy in work, I don't think I did.
So we need to get that chest X-ray, and because you've smoked for a long time, you could potentially have something called COPD, chronic obstructive pulmonary disease, and it's basically where there's damage to your airways, and that can sometimes mean that you get more chest infections regularly.
Oh, I see.
Right, if we can have a listen to your chest. If you pop your jacket off and your jumper as well. Right, nice deep breaths for me. And out. OK. So your chest sounds reasonably clear. There's definitely not any wheeze there.
That's good. That's good news.
You've got a few fine crackles, a little bit lower down on both sides, but nothing severe. Have a lean forwards for me. I'm just going to tap on your back.
OK. You know, I tried to give up smoking last week, and I carried on for 3 days.
OK.
And when I give up smoking, I become a very quick lose temper. You do not believe. I'm like a Spanish bull, having head down, going blah, 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 blah. I said to my wife, I'm going back. She said, I know, go back. You did before. You tried to give up before, I know.
So do you want to give up smoking?
I do.
We have specialist nurses that can help you to give up smoking, and all the evidence shows that if you have the help of somebody else, it's a lot more likely to be successful, and that
I think that's the best,
help.
yes.
With regards to your breathing now, I don't think you need any antibiotics, but we need to get you to have this chest X-ray. So I will book you on for the chest X-ray.
Lovely. Thank you for your help.
You're welcome.
Thank you.
Take care. Bye.
Thank you. Bye-bye.
That's yes.
Hiya.
Come and have a seat. OK. So we're having a look at your legs, aren't we, to see what's... So we did a scan to exclude a DVT.
Yeah, but no, I've got no pain at all with it, or aching, or burning, or... I went round the garden centres that Saturday, so a lot of traipsing around, and Sunday they seem to have gone down.
Interesting. Gravity will take fluid down to your feet and into your legs, and activity will bring it back up. I just want to check your blood results, because sometimes, you know, things within that can explain the swelling. So your albumin level, that was the thing I was interested in, and it's a tiny bit low, so it's a sort of protein in the body, and if that drops a little bit, you can get a bit of swelling. It's just under the normal range, so that might account for this swelling in your leg. But as I say, my main concern was if you're getting a blood clot, because with a cancer you're more at risk of blood clots. So having excluded that, I kind of, you know, then I'm not interested anymore. That's not true. Bradley has prostate cancer, which has spread to the bones. It had spread in this manner when it was diagnosed back in 2012. He's been receiving regular treatment from oncology during the past 5 years to prevent further spread of the cancer.
It was just the other other night I had a terrible episode where I was so ill. Just felt so incredibly ill. But a couple of hours later, I was, all right. Didn't feel sick. Didn't have any aches, but just ill. Yeah.
And you're actively having treatment as well at the moment, aren't you? Having the radium...
223,
yes. Is your treatment once a week?
No, once a month.
Once a month, right,
yeah.
OK, so yeah.
So, but they're very good down there. You know, I can't, praise, like, oncology and, well, all you guys enough, like, everybody's been fantastic. Unfortunately...
It's been a bit relentless, hasn't it?
Yeah.
It's one lot of treatment.
Well, I think Pam was a bit down the other day because it's hospital appointments and, she said, it'd be nice just to have a day off from all this, My main concern is, like, when I lose control of everything, I've accepted, I'm OK with it, I know what's going to happen, but...
Yes.
Initially, I said, I'll just stay home and die at home. But then seeing how much work was involved with that, so I said, well, now I'll go into a hospice. And then the more you think about it, I probably won't get a choice, I know when I go out that door, I'm not going back.
Yes.
That's the end of the story. But then being carted off somewhere... strange, and I think I just want to go to sleep, feel a bit rough one night, go to sleep and not wake up.
Yes.
What do you think all this might be?
I think it might just be stress.
OK.
I just thought it's due to stress, and it's just stress and stress.
Have you had any particularly stressful events or anything like that? Or...
I got quite panicky today. I was just sitting there, and all of a sudden I'm like, I can't think of how to breathe right now. What's going on?
Are you stressed at work?
Life is stressed, but yeah.
Do you suffer with mood issues or anxiety at all?
Stress is something that's always been part of my life. I just feel like from one minute to the other, I start shaking. I feel like I'm going to collapse on the street.
I had a period of a lot of stress, so I started doing yoga, and I am feeling loads better.
Oh, that's brilliant. So you're actually sorting out your physical, mental and spiritual health, or, all of it.
No, they were saying it may be a bit of stress.
I know stress is a horrible thing, but it happens to all of us.
Yeah.
So, how are things going since we last met up?
Well, I've been doing a headache diary.
Have you noticed anything interesting or enlightening?
Well, mornings it's generally either no headache or like a 2 or something like that, and then it just gradually builds up.
Yeah.
Went to the optometrist.
Yeah.
They said it's got nothing to do with your eyes.
Yeah. Are you still getting headaches all the time?
In the last couple of days, I've been waking up with no headache, which is something different.
Right.
I think this could all just be down to just work.
So, OK, what can you do to counter that, then, or balance that out?
One thing I can do is probably take a few more breaks at work, that's for sure. I tend to, a 13-hour day without even quibbling about it and just crack on,
What I see both professionally and personally, with friends and family as well as at work, is that I think people keep going, and then sometimes if you don't do anything, something gives, and you can get with something quite serious, I think stress is implicated in a lot of illnesses, and quite serious illnesses, more physical problems as well. So I think it's really important to take note of it. Sometimes we get to a point when it's getting a bit too much, and I do think often that's when our bodies will tell us something, and saying, well, hang on a minute, maybe you need to stop and redress it and look at it. We know that stress is a big factor in many illnesses, both physical and mental. And we also know that many people are overworking, working harder than they want to, finding it difficult to switch off, and they haven't achieved a good work-life balance. In addition to that, we recognise that at Christmas there are a lot of additional stresses. For example, often being very busy and sociable, spending money that perhaps we don't have. So we recognise it's important after the Christmas and New Year period for us to rest, relax and recoup and perhaps reflect on where we're at and what's a good way to move forward. I appreciate often professionally it's difficult to change things, but I mean, do you think there are things you can change?
I've been having a chat with the bosses, and they're also, you know, quite concerned about the whole situation. Got another person on board. We're trying to, you know, there's a lot of active stuff that we're doing at work.
And do you think that's going to work?
I think so.
I'm going to book you in to see me in a fortnight.
Yep.
Because I want to see how you're doing from the point of view of the headaches. All right.
Thank you very much.
Thanks, Dawn. Nice
Cheers.
to see you again. Cheers. Bye
Cheers.
now.
See you later.
Good luck with it all.
It's hard, isn't it? Because you're kind of... You need to be planning in your head... that the end is coming one day. But actually, I want you to be living for the moment as well and enjoying what you have left.
I don't sort of dwell on it. I'm not depressed or anything. Sometimes I'll just sit down and write a letter to Pam or to the grandkids. Because that was another thing that sort of scared me, was being so drugged up towards the end. Yeah, I might not even recognise anybody. Yeah.
I think we never know. We just don't know what position people are in.
Writing things I want to say.
Yes.
Sometimes when Pam reads them, it upsets her. Then she's all right with it.
Yes.
Yeah.
For patients with cancer, our role is very important. We know the patient, we know their family, and we are often at the centre of the decisions around care. We prescribe with the assistance of the palliative care team. But we're also just there to offer support and talk through any concerns. Some people don't want to talk about the fact that they're dying. Bradley's able to talk about it, and he remains positive, pragmatic and realistic about the future. Have you got a will?
Yeah. That's all that, but mostly, funerals paid for and all stuff like that. All in all, I'm pretty good. I'm, keeping... Well, I was going to say well. I'm keeping all right, Right.
Excellent.
Well, nice to see you.
Nice to see you too, and I will see you when you need me. Yeah.
Any problems, I'll give you a bell.
Me. Yeah.
All right, thank you very much. Oh.
OK, see you again.
All right, lovely. Thank
Bye-bye.
you very much. Bye-bye.
Proceed. Right, how can I help? I started to have a bit of a pain in my stomach and a bit of a cough, and I thought it might have been something I'd ate or something. It's kind of been rumbling over the weekend, but it's kind of changed. I've still got this cough, but now I'm getting this pain sort of up here, which radiates like my back.
OK. And how long does it last?
Well, a severe one's probably about 10 seconds, but this morning it was really bad, and it was happening every 30 seconds. I'd have this weird wave.
And you're eating OK?
Yeah, eating fine, no sort of loss of appetite or anything like that.
Right, let's check you over and see.
Thank you.
Yep, it's completely fine. Be easier if you came over here.
Yeah.
You OK lying down?
Yeah, of course.
So I'm going to feel all over.
Yeah, that's fine.
And you tell me if I get the place where it hurts. It's definitely not more right or left.
No.
No.
Yeah, that's just there.
There?
Yeah.
Definitely there, right. And we should take a really deep breath. I'm just checking your gallbladder. And then breathe out.
A bit.
That's a bit.
Yeah, just a bit there. And there.
There, definitely.
Yeah.
Come and sit down. Right. Your chest, your lungs and your heart all sound fine. Your blood pressure and temperature are fine.
Yeah.
I think what it is, you're really tender around the top bound of your stomach.
Yeah.
And I think that's probably what's happened, is you've probably got a bit of inflammation inside your stomach.
OK.
And that's what's causing you all these sudden pains. I think you've got a bit of gastritis. OK. Have you taken anything for it at all?
I've only been taking sort of Alka-Seltzer, paracetamol, just because that settles my stomach.
That's a good idea. I think what we should do is give you something a bit stronger, something called omeprazole, which is a tablet to take 1 a day for a month, and normally that gets it better pretty quickly.
Yeah.
The other thing is to alter your diet a little bit. The sort of thing that makes this bad is things like curry, spicy food, very acidic food, and alcohol.
Yeah.
What about smoking?
Yes, I do smoke.
OK. A lot? Or
no, not really. Probably about 10 to 15 a day.
Yeah, I mean, smoking does make you much, much more likely to get this kind of thing, unfortunately. Have you thought about trying to stop?
I have tried to give up before.
Yes.
It's just proven difficult, and I've had a vape, and I've tried the patches, but I had a reaction to the patches, so I couldn't try that. The chewing gum was quite good.
I mean, a lot of people have to try quite a lot of times before they get there in the end.
Yeah.
But it doesn't mean to stop trying.
Yeah.
Right, so I've sent that to the chemist.
That's great.
Thanks very much for that. Bye-bye.
Bye.
Okay, come and grab a seat.
Thank you very
much.
much.
Hello there. Your mum, aren't you? Yeah. Drag up.
Thank you.
Okay. Okay, what do we need to talk about?
Oh, God, everything.
What's the most important things we need to talk about?
I've been trying to lose weight, and I've got, like, ME and stuff, so it's obviously difficult. I've been sticking to, like, 1,200 calories a day.
OK, well done.
And I've also, like, had to go to physio for my shoulder, and there was, like, exercises they gave me to do, which are, like, daily. So I've been doing them, and I've managed to up it a bit and sort of add in, like, a sit-up here and there and some squats, and... But I'm just gaining and gaining weight.
She's just very hard on herself. She works extremely hard and she exercises every day. And before, if I said this time last year, she'd have lost the weight a couple of weeks down to her, not skinny, because you're not a skinny person, but she'd be fit and she'd feel quite able. But she's doing the same things, if not more, and she's not losing anything. And also her moods are awful.
That's
to the point that it's like, I'll move out. I'll live with the cat in the little shack at the end of the garden, because it's like it's really like walking on eggshells. Seriously, it's like.
What did you think of that? What Mum just said?
It's fair. I suffer from depression, and as soon as it's like moods, it's like depression will get you back on the tablets. And I don't feel that I'm anywhere near that headspace that I get into when I'm depressed. Like I don't feel. I'm not crying at co-op adverts. That's always the signs. But I am definitely like I'll sit there and then Mum will say something. I'm like like hulking out. And there's no need for me to get angry. But I don't think it's depression.
No, I mean, I must say, I don't get the impression that you're depressed from the way you're talking and from the things that you're saying, actually. So you may sometimes be irritable, but that's not quite the same thing.
Yeah. But I think the weight at the minute is your biggest issue.
You told me that you're being careful with what you eat, you're keeping to a low-calorie diet.
Yeah.
And you've talked about your weight going on.
I was 13 stone last week and I'm up to 13.5 when I weighed myself yesterday.
In just under a year, you've gone from 78 to 85.
Yeah, it has sort of...
Which obviously is a significant weight gain. I mean, a couple of things. One is if you can learn to eat slower. A lot of us are wolfers, aren't we?
Yeah,
you know,
I definitely think I'm a wolfer.
You put in too much before your brain says, hey, I'm full. Make sure you put your hands down between each mouthful. So you take a mouthful, put your knife and fork down, sit on your hand.
OK.
You finished it. Then take the next mouthful.
Yeah. You're so going to have to get on me about doing that.
OK, well, but everyone can do it, can't they? That's a top tip. Another top tip, which I expect you've done already, is to use a smaller plate.
Yeah.
Use a side plate instead of a large plate. And don't come back for seconds.
Once I leave that kitchen, I'm out. No going back.
So is that helpful?
Yeah. Cool.
OK.
I will start doing that. Thank you very much.
Yeah, let's do it. OK.
Oh.
Sure then. Okay.
Thank you.
Bye-bye.
Bye.
How can I help?
My wife's nagging me about a possible vasectomy.
So what's made you think that would be the right thing to do?
I don't want any more children.
Right.
I'm married, I got 2 children, 2 little boys. Financially, physically, and my wife as well.
That's enough.
We always said we'd have 2.
Yeah.
People question because we've got 2 boys, you know, you might want a girl. It's like, well, yeah, I'm right.
Yeah, fine. And at the moment, what contraception are you using as a couple?
She's having trouble with the pill that she's on, making her quite ill, so we're using condoms and stuff as well.
OK.
And she's going to have an injection, I think, in the next couple of weeks, I think,
OK, fine. So the situation, interestingly, has changed a bit about referring for a vasectomy now.
OK.
So in the past, until very recently, I would have just referred you for a vasectomy because you want one.
Yep.
But it's changed now that we now need to have tried other methods of contraception, mainly that the women use, obviously, because there are no other methods for men apart from condoms. And they have to have been unsuitable before we are allowed to refer you for a vasectomy.
Right. OK.
And the reason for that is quite sensible, actually. When a woman is using contraception, she also gets some non-contraceptive benefits.
Right.
Like periods can go on the injection, so that's quite nice.
OK.
Or can become less heavy if you're have a particular sort of coil or the pill.
Yeah, because the pill she's on at the moment, she has quite, like, every couple of weeks, and she's having quite a lot of pain.
So that's
with it,
really
which
not
is why...
working for her.
No, and it's not for a while now, I don't think, not probably since
So I think it's a really good idea for her to try the injection. And if that works for her as a method of contraception, then what has been decided in this local area is that that will be the method of contraception rather than you have a vasectomy. And the other good reason for that is that having a vasectomy is actually an operation and has some small risks associated with it.
Of course.
And so that are more than your partner having the depot injection, OK?
OK.
So what I suggest is that she has a go at seeing how the injection goes.
Yeah.
If she's unhappy with that as a method of contraception, then she should come back and see her own doctor and talk through other options. And then once all the options are tried for the woman, if they fail, then we can refer you for vasectomy. So we have tried to refer a few people who haven't tried the depot injection and haven't tried a coil, and it's been rejected.
Right, OK.
OK? All right,
thank you very much.
That's OK.
Thank you.
Bye now.
Goodbye.
Barry Thomas, please. Have a seat.
Thank you.
Right, what can I do for you?
What it is, first of all, I got fluid on my leg.
So when you say you've got fluid on your leg, what do you mean exactly?
Well, it's like... See?
Right, OK. So I think what we need to think about is why they're a bit swollen.
Well, I think it's the... Sorry, I'm out of breath.
Yeah, so take your time.
Yeah.
Catch your breath a second.
Right. I think it's the blood pressure tablets normally do it.
OK. Catch your breath.
Yeah. Because I'm on that.
OK,
yeah,
calm down.
All right, OK.
I'll have a look at your medication.
Yeah, yeah.
And you take a break.
Do you smoke at all?
I do, yeah.
How many a day?
Probably about 15.
How many years have you smoked?
Since I was 17.
So about 40 years.
You're not a smoker?
I'm a smoker.
You are a smoker?
Any plans of stopping?
I have tried to stop. I tried to vape. I just can't get on with it. I really can't.
Have you got any thoughts about trying to stop I do want to quit, yeah. Just not got no willpower at the moment.
I tried the patches a few years ago and put it on my arm, and it just burnt on my arm, and near enough blistered up. So I was like, oh, let's go in.
I'm not ready to give up, really.
Why is that? What do you think would need to change for you?
I don't know. I just enjoy it.
And the chewing gum tastes horrible, and the thing you suck on tastes horrible. And
Come and see someone in the treatment room.
I'll try.
Because they do some magic in there.
You are smoking, aren't you? Which obviously it would be good to cut back on the smoking. I don't know how you feel about that.
No.
So you've got diabetes, you've got COPD.
Yeah.
Blood pressure.
Yeah.
And was it a heart attack you had in September 2015?
Yeah.
Yeah, OK. And then I'll have a look at your blood pressure. You're on a bit of a cocktail. Right, you've got your breath now.
Yeah, yeah.
OK.
Yeah.
So tell me how long this has been a problem.
Weeks now, probably weeks. If I try to do any walking, right, OK?
Yeah.
Then it swells, swells up
OK.
again.
And is it both legs?
I don't know, no, this one ain't so bad, because I got chicken legs anyway, but, you know what I mean? Sorry.
It's all right. OK. So what about your breathing?
Yeah, my breathing's pretty been... Because the thing is, see, I stopped smoking, right?
Well done.
But I start again, right? I can go 3-4 days cold turkey, not worry about it.
Yeah.
And then, for some reason, my breathing gets better, right? And I'll smoke again, but I'm still battling it, right?
Okay.
Do you know what I mean?
Keep battling it.
Yeah. Oh, yeah, I got to, because I feel so much better when I stop smoking.
Because when people first stop smoking, the tiny little hairs in the airways that have deadened with the cigarettes start to come alive again. And they work and start to bring the muck up again.
Right.
All right? So it can get worse before it gets better. Are you coughing anything up?
Yeah, sort of greeny phlegmish. Yeah.
Any chest pain?
Little bit of discomfort, I guess. Most of the time is when I smoke.
When you smoke?
When I smoke. If I don't smoke,
I don't get
I get no pain. Right. I don't stress about it. I don't start thinking about dying and all this stuff.
Okay.
I'm like, you know what I mean? It's like.
Right. Let's have a little look at you. Let's check your blood pressure. So to stop the cigarettes, have you seen our nurses for help?
No, every time, it's like weeks away, isn't it? And every time...
Yeah, but the thing is...
Every time I go there, every time I got to see her, I've already stopped.
Yeah, but the thing
and
is,
then I don't,
if you do it with their help, you're more likely to stay off the cigarettes.
Yeah.
All right?
You're right there, I know that.
So keep your arms straight.
Right.
OK, bit high. OK, let me have a little listen to your heart and your chest, OK? Can I pull this up?
Yeah, of course.
Deep breaths. And out. OK. So look at these legs. Right, if you pull your trousers up. Right, OK. I'm going to give you some antibiotics because you're coughing up green muck. You're a bit breathless.
Right,
all right?
Yeah.
I think that's related to the smoking, OK? But I think we need...
both know that,
But I think we need a bit of an MOT. I think what could be happening, your heart could be struggling a bit to pump all the fluid around, and that's why it's accumulating on the legs. All right?
Okay,
So I think we need an ECG, bloods and a chest X-ray to help us work out if there's some signs of heart failure.
I thought you was going to call it ambulance. I thought it was like dancing along.
No,
Oh, my God.
you're not that bad yet, but let's get things better.
All right, cool.
All right?
All right, thank you.
No problem. Nice to see you.
And you.
Bye-bye.
Thank you.
How are things? What are we talking about today?
Good things and new things. Good things is that I've been able to dramatically change my situation at home, finally.
Excellent. Much better for you.
And then I've started to make goals that are achievable in the short, middle, and long term, which is really good. Actually, I don't think I've ever done that in my whole life. The first one, the now was the house, obviously, to make my environment livable again. And the middle term is I've had this idea in my head for many years of making a drumming ensemble of many different drumming culture, like a world music, all in one place.
Sounds fantastic. Yeah.
So that's going to happen, which is amazing. And in the long term, I've already asked for a couple of prospectuses from the Open University because I need some intellectual stimulation so badly.
That's brilliant, George.
Thank you.
And I wish...
I take it as a compliment because it's really been difficult to get to this place.
You said to me last time that you're not going to take the antidepressants and we're going to look into how to manage things. So you've done that for yourself.
Yeah, definitely.
Found out what your needs are and go forward.
And I feel really good, especially mentally. I'm in a really good mental space where I've been eating fish every day, and it's kind of given me some clarity, I think, some sharpness or something.
Your blood tests, kidney function, blood count, liver function, lipids that they did at the Brecon unit are all fine. So a lot of symptoms have settled down that we talked about last time. We've come a long way, and it's fantastic to see that. So I'll leave that up to you as to when we touch base.
OK.
So that's a list of things that we've talked about today. But I'm really happy with your short, medium and long-term goals.
Me too.
That's brilliant.
Me too.
Good. Nice to see you, George.
Likewise.
Good. Take care.
OK, bye-bye.
Bye, George.
Thank you.
All right, bye now.
Thank you very much for your time.
OK, no worries. My New Year's resolution is to address my work-life balance. I'd really like to finish work in time to get home for my son's bedtime.
I've always thought about joining an amateur dramatics society, and next year may be the year that I do that.
Thank you so much.
No problem. OK, all the best.
My plan for 2018 is to run London Marathon.
That's lovely, Doctor.
Super.
Thank you very much indeed. Appreciate your time.
In 2018, I plan to spend less time online and more time with my family and doing things outdoors.